Hi everyone, my name's Emily. In my group, I had Kiri, Lori, and Norman. We focused on skin cancer in Mason County, Michigan. This is for Nurse 340 at Ferris State University. In our PowerPoint, we're going to have an analysis of the community in Mason County, a problem statement, evidence-based interventions and analysis, goals, theoretical support, a health belief model, evaluation, time frame for change, intermediate outcomes, and policy implications. Mason County is located on the shore of Lake Michigan, and it is most known for its world-class beaches, Ludington State Park, and Manistee National Park. Mason County has numerous inland lakes and rivers, attracting outdoor enthusiasts that enjoy hiking, biking, swimming, and boating. The land and climate allows for commercial fruit and vegetable production. Mason County is a tourist destination with an estimated 30,000 visitors a year. The summer months see the most visitors. In 2015, 7% of adults in Mason County had or has skin cancer. This percentage is compared to the percentage of all adults living in District Health Department Number 10, or DHD, who have or had skin cancer. The percentage of adults in DHD with skin cancer was 4.9%. That shows that there is a 2.1 increase in skin cancer just in Mason County. Factors that contribute to the difference could be lack of education on the importance of using some sort of sun protection, lack of motivation to apply sunscreen before leaving the house, and not wanting to be judged by others for looking like a ghost. The media portrays images of looking tan and healthy. Another factor is that generally, people with skin cancer are diagnosed after the age of 40. According to the AAD, before age 50, melanoma incident rates are higher in women than in men, but by age 60, rates are twice as high in men. This means that there could be other comorbidities that the adult is dealing with. If the adult is on a limited budget, they could be using limited finances on other conditions such as heart disease medications and therapies, therefore not focusing on skin cancer issues. The adults could have inadequate insurance. Also, medical staff may not be properly screening for skin cancer during yearly physicals. The Office of Management and Budget states that a metropolitan area must have one city with 50,000 people or more. The District Health Department states that the total population of Mason County in 2015 was 28,824. Therefore, Mason County is defined as a rural area. According to Harkness, people in rural areas must fight social inequities and health disparities. All age groups are affected by skin cancer as UV radiation accumulates in the skin over time. The most vulnerable of the population are anyone with a history of melanoma, with light/fair skin that burns easily, a history of excessive skin exposure, immune-suppressing diseases, or treatments. Anyone with more than 50 moles, atypical mole, or anyone with light skin and freckles. Existing resources are dermatologists, family doctors, home health nurses, department health nurses, and health clinic nurses. Skin cancer is an appropriate area for nursing intervention as it is the most common cancer in the United States, and that about 75% of skin cancer deaths are from melanoma. Other disciplines would be hospitals, volunteers, and employees of community organizations. Community organizations in Mason County would be the Mason County Council on Aging, Stomp Out Cancer Fund for Manistee and Mason counties, Friasaw Area Senior Center, Ludington Area Senior Center, Scottville Area Senior Center, Tallman Lake Area Senior Center, Hands Extended Loving People, also known as HELP. Meals on Wheels could also be used to distribute sunscreen to others that can't leave the house very easily. Resale shops could be utilized to distribute protective clothing. Food pantries could hand out sunscreen from donations. A local club could do an event to raise money and funds to buy sunscreen. Lifeguards could be utilized to have free sunscreen to hand out. A donation box on the beach where people could donate or take sunscreen or protective clothing could be used. The various canoe/boat rental companies could have sunscreen available to buy. All these are likely partners. Mason County has many strengths. According to DHD, most have had no problem receiving needed medical care, and strong majority of of the population have routine physical checkups and health screens/tests. These stats show that this community is motivated at staying in good physical condition and is open to receiving direction and advice on preventative measures. Since most of the population receive routine physical checkups, there should be no reason not to include a skin cancer screen with the physical. Barriers would not be enough time for volunteers and employees to distribute sunscreen, the staff not thinking it is important enough, not enough sunscreen and clothes available to distribute, lack of transportation to get sunscreen to available community members, lack of access to rural areas, and the weather. The analysis focused on adults with chronic skin cancer only. Problem statement. Adults in Mason County, Michigan have a higher diagnosis of skin cancer compared to other counties in District Health Department number 10. The easiest way to decrease skin cancer is by donning adequate clothing and hat while outside, applying an adequate amount of sunscreen throughout the day, and avoiding the sun during the hours of 10 a.m. to 2 p.m. With these interventions, a decrease in the percentage of skin cancer diagnosis should be measured. The goal is to have the diagnosis of skin cancer to be less than 4.9% by 2020. The consumption of sunscreen should also increase. Evidence-based interventions and analysis. Nurses can implement primary prevention interventions to educate community members on patient self-assessment, creating a sun-safe environment, the use of appropriate sunscreen, the use of wearing protective clothing, avoidance of tanning in sunbeds, tanning salons. Screenings and preventative care could be performed on the population at whole, children, teens, adults, and seniors. Skin cancer, primarily melanoma, is a leading cause of morbidity and mortality in the United States. Who is affected by this? In 2015, 73,800 people were diagnosed with melanoma in the United States, and 9,940 deaths occurred from this disease. Patient self-assessment. Clinical experience and clinical studies show that patients play an important role in detection of their own melanomas/skin lesions. Brady et al. Evaluated 471 newly diagnosed melanoma patients between 1995 and 1998 and found that up to 57% were able to detect their own melanomas by patient skin self-examination. Reduce sun exposure, especially during peak hours, 10 a.m. to 2 p.m. Create sun-safe environments. You can reduce your risk of skin damage and skin cancer by seeking shade under an umbrella, tree, or other shelter before you need relief from the sun. Use sunscreen with the SPF 15 or higher and contains both ultraviolet A and ultraviolet B protection. UVA rays penetrate deeper through the epidermis into the lower layers of skin known as the dermis. UVB rays penetrate the upper layers of the skin known as the epidermis and cause the skin to burn. Use a broad spectrum sunscreen with at least sun protection factor 15 or SPF. Before you go outside, even on slightly cloudy or cool days, don't forget to apply a thick layer on all parts of exposed skin. Get help for the hard to reach places like your back. Reapply after swimming or sweating. If you are out in the sun more than 2 hours, reapply. Be sure to check the expiration date on sunscreen. They have a shelf life of no more than 3 years and shorter if exposed to high temperatures. Avoid indoor tanning. Indoor tanning exposes users to two types of ultraviolet rays, UVA and UVB, which damages the skin and can lead to cancer. Indoor tanning is particularly dangerous for younger users. People who begin indoor tanning during adolescence or early adulthood have a higher risk of getting melanoma. This may be due to a greater use of indoor tanning among those who begin tanning at earlier ages. Wear sun protective clothing. When possible, long sleeve shirts and long pants and skirts can provide protection from UV violet rays. Clothes made from tightly woven fabric offer the best protection. A wet t-shirt offers much less ultraviolet protection than a dry one. Darker colors may offer more protection than lighter colors. Some clothing certified under international standards comes with information on its ultraviolet protection factor. If wearing this type of clothing is not practical, at least wear a t-shirt or a beach cover-up. Typically, a t-shirt has a SPF rating lower than 15, so use other types of protection as well. Wear a hat with a brim that shades your face, ears, and the back of your neck. Tightly woven fabric such as canvas works best to protect your skin from ultraviolet rays. Avoid straw hats with holes that let sunlight through. A darker hat may offer more ultraviolet protection than a lighter. Goal number 1. Citizens of Mason County will be aware of the monthly skin assessment ABCs. SMART objectives. S. Nurses in the community will post flyers and educational signs at local beaches, businesses along the beach area, and also doctors' offices. A stands for asymmetrical in shape. B, border irregularity. C, color not uniform. D, diameter greater than 6 millimeters. E, evolution. Something has changed in the mole. M, the healthcare community will know if their education attempts have been successful with a decrease in frequency in skin cancer in the Mason County area. A, with the education provided by the local Mason County goal is achievable. R, Mason County's occurrence of skin cancer exceeds the state level of skin cancer occurrences. With education of skin cancer prevention, this may aid in a decrease in these rates. T, reassessment of the rates of the skin cancer will be reevaluated in 1 year. Goal number 2. Citizens of Mason County will be able to verbalize and understand who is the greatest at risk for acquiring skin cancer. S. Nurses are responsible for educating the community. Some examples that nurses can do are provide segments on the local news, information nights at the local schools/community buildings. Who's at risk? People with naturally fair skin, blue eyes, and red hair, infants and young kids, people with family history of skin cancer or who burn easily, individuals with a lot of moles, individuals who are immunosuppressed. M. Assessment of knowledge with a short survey provided before the education presentation. Then the same survey will be provided to the community members to assess the quantity of knowledge they have gained. A. The community will have the knowledge of following the informational segments with local nurses. R. Mason County's occurrence of skin cancer exceeds the state level of skin cancer occurrences. With education of skin cancer prevention, this may aid in a decrease in these rates. With knowing what citizens are most at risk will allow community nurses to better assess who will need the most education and assessment. T. Reassessment of the rates of skin cancer will be reevaluated in 1 year. The more information and education provided to community members, the lower the rates of skin cancer should be. Theoretical support. The health belief model is an effective change theory model that can be used to implement preventions and promote healthy behaviors in Mason County. The health belief model supports that individuals' health behaviors are based on the severity of the potential illness or physical change, level of conceived susceptibility, benefits of taking action, what stands in the way of taking action towards health promotion. Health belief models. On the left is the framework for the health belief model along with the description of each category. On the right we've provided is the health belief model applied to the citizens of Mason County, designed to reduce skin cancer rates in this area. Evaluation. The desired outcome. The desired outcome is to raise awareness about the dangers of excessive sun and UV exposure and implement effective strategies to reduce the incidence of skin cancer in Mason County. Time frame for change. How long until the changes occur? The Center for Disease Control and Prevention point out preventative measures can take years to affect the incidence rates of skin cancer. Monitoring behavioral indicators such as the use of sun protection, prevalence of sunburn, and rates of indoor tanning are effective methods to measure progress of intervention strategies and preventing future cases of skin cancer. Monitoring behavioral indicators is an effective way to measure progress towards reducing skin cancer until incidence rates begin to reflect change. Intermediate outcomes to track progress until incident rates are affected. Community surveys asking questions such as how often do you use sun protection, prevalence of sunburn, use of indoor tanning. These surveys can be used to evaluate progress toward reducing future skin cancer rates in Mason County. Conducting community surveys at public places such as beaches, parks, supermarkets, hospitals, and local health departments to determine rates of healthy behaviors such as wearing sun protection, avoiding sunburn, avoiding indoor tanning, wearing protective clothing, and seeking shelter from sun. Conduct analysis of survey responses for adopting healthy behaviors and measure progress between surveys. Surveys can be administered by healthcare professionals, caseworkers, participating community establishments, including restaurants and stores. Available measures to track changes. Monitoring the Mason County Health Profile Chartbook for changes in skin cancer incident rates. Monitor melanoma skin cancer rates in Michigan at cancer.gov. DHD-10 formed a program called the Lake Mecosta and Osceola Cancer Prevention Coalition, offering free skin cancer screenings at outdoor events and education. Monitor skin cancer screening rates and evaluate the number of residents seeking free skin cancer screenings and number of potential cases identified. Policy implications. Public health policies are decisions made by public officials in regards to the health of individuals and community. Nurses' knowledge, clinical experience, professional experience, and trust by the community are key factors that must be utilized when developing public health policy. Nurses are excellent candidates to design initiatives promoting skin cancer prevention to reduce incident rates in Mason County. Applying sunscreen before going outside and every 2 hours is a key strategy for reducing excessive sun exposure and preventing skin cancer. Skin cancer is one of the most commonly diagnosed cancers in the United States. Approximately 5 million people are treated for skin cancer annually at a cost of $8.1 billion. The applying of sunscreen before going outside and every 2 hours is a key strategy for reducing excessive sun exposure and preventing skin cancer. Sunscreen reduces the risk for actinic keratosis, most common precancer lesions, squamous cell carcinoma, the second most common skin cancer, and helps protect against melanoma, the deadliest skin cancer. Initiatives promoting sunscreen use will prevent excessive sun exposure and reduce the risk of developing skin cancer.